Hey guys, this is the doc. Doc to me. This week I've had to deal with a lot of depression, patients diagnosed with it, patients not yet officially diagnosed, but presenting with symptoms. And often folks ask me, how do you know you're depressed and not just sad? And the truth is that all too often these could be one and the same in some cases. Sometimes you're sad just because you're sad. It's a natural human emotion. However, sometimes there's a clinical element to this, a clinical diagnosis associated with it, a psychological diagnosis, psychiatric illness, if you will, associated with it. And we'll often identify this with some symptoms, including elements like a loss of energy, a lack of being able to concentrate, a lack of being able to get some sleep, insomnia, if you will. Folks sometimes feel a sense of guilt, this overwhelming sense of guilt that seems to be just beyond reason sometimes. Folks might lose interest in the things that they generally love to do. And all too often we have multiple of these at play, not necessarily all of them, and there are a few others I may not necessarily touch on. Sometimes people start to feel what we call psychosomatic, if you will, psychomotor type of symptoms where they actually start to feel pain. I remember a commercial from, 10, 12, 15 years ago that used to say, I forget if it was for Rick Salty or what, depression hurts. Quite true. If you ever heard a statement like this, anyone who's dealt with this can probably attest to the fact that sometimes there are symptoms that may not necessarily be physiologic in their nature, not original from the body, but from what the mind is feeling that registers in the form of pain or tingling or numbness or some other kind of condition. It is estimated quite recently, within these last 4 years, that the number of folks 18 years and older in just the United States, we're not talking North America, we're not talking the English-speaking world, we're not talking the West, we're not talking the world, just in the United States, that about 1 in every 12 or so Americans 18 years and older suffers from some measure of depression, has had at least one depressive episode, if you will. That's a lot of people. It's about 8.3% of 18 years and older. And we're not even talking about teenagers, don't get me started there, or preteens for that matter, to the extent of all these flux of hormones and neurotransmitters at play with depression in these individuals. A lot of times depression could be just like we might say for anxiety, impacted by external factors, things that are happening, losses, bad things that are happening around you. And sometimes it could be the result of internal factors involving neurotransmitters in the brain that get imbalanced and start to create issues. And medications for depression have been prescribed extensively in these last 40 years. There's been a lot more focus on diagnosing mental health disorders as civilization has advanced over time, and there certainly is a push lately towards identifying these and addressing them. Still not enough has been done. I'm going to keep this discussion empirical. If you or anyone you love is experiencing depression, reach out to your health provider. You may need a referral to a psychiatrist or a mental health counselor. It is absolutely crucial that you look into this. Depression can lead to worse outcomes, including suicidal ideations. If you or anyone you love is suffering some suicidal ideation or contemplating self-harm, call the number below. It's a suicide hotline. Depression is serious business. This has been the doc. Doc to me.